Hello, my name is Malcolm Tan. I'm a gastroenterologist working at the Department of Gastroenterology and Hepatology, Singapore General Hospital. My advanced subspecialty interest is in IBD, or Inflammatory Bowel Disease. I previously spent some time in Oxford as a fellow for further training and experience in diagnosing and managing patients with ulcerative colitis and Crohn's disease. What we will do today is to tackle some of the questions you may have on ulcerative colitis. We will cover the causes, symptoms, and general management principles patients and doctors should undertake. We hope you find this useful. Ulcerative colitis, or UC for short, is one of two types of inflammatory bowel disease, the other being Crohn's disease. UC affects the large intestine or colon. It is characterized by inflammation of the innermost lining of the colon known as a mucosa. However, despite its name, only patients with severe disease develop ulcers. Most patients instead will have redness, swelling or bleeding on the colon seen on endoscopy. Patients with UC can have associated conditions that involve other organs such as the skin, joints or eyes, which may or may not parallel the inflammation in the gut. The precise cause remains unknown, but we understand there is an interaction between the genetics, altered microbiome, dysregulated immune response, and the environment. It mostly affects young people, but it can affect anyone in any stage of his life. Many genes have been identified to be associated with UC, but most may not be causal. Most of these genes have something to do with the immune system, whose functions include sensing and fighting harmful bacteria in the gut. These genes may have been useful in our ancestors, but not in us, because we currently live in hygienic conditions. It is more likely that the modern diet plays a major role, with the inclusion of processed foods, additives, and preservatives. This modern diet is sweeping across the globe, which explains why we see IBD in many countries, especially in developing nations. At the level of the gut lining, or mucosa, there is an interaction between the gut contents, such as digested food particles, bacterial proteins, with the immune cells which keep unwanted particles away from our bloodstream. When this control is dysregulated, there is an inappropriate response from our immune system, and the result is inflammation and damage of the gut. Of late, there is more interest in environmental factors as these are the ones we can potentially change. Researchers are looking at diet, food additives, antibiotics use, industrial pollution, smoking, travel, stress, and exercise. Our environment is very different from our ancestors. We share much of our DNA with them, but the world we live in and the diet we consume have drastically changed since. It is very likely that our environment is shaping our microbiome, and that this alteration, against the genetic background, is driving the dysregulated immune response to the gut. For an individual, inflammation of the colon causes gut symptoms like diarrhea, rectal bleeding, and urgency. There are other symptoms such as bloating, constipation. There are also psychosocial symptoms impacting a patient's energy levels, mood, sleep, and anxiety. In addition, patients with other organ involvement may experience symptoms specific to those organs. For example, a patient with scleritis may have red and painful eyes, or a patient with erythema nodosa may have painful rashes on her shins. The cause of UC is classically that of relapsing and remitting, and progresses over time. UC is diagnosed by a gastroenterologist using a combination of assessments. This would include the evaluation of symptoms, laboratory tests, and colonoscopy. A colonoscopy is essential to making a diagnosis of UC, as it allows for careful inspection of the mucosa and biopsy samples to be taken and examined by a pathologist. Once other causes are excluded and all findings are consistent with UC, then a diagnosis can be made and treatment started. The severity of disease activity can be classified into mild, moderate, or severe, depending on the following factors. A combination of symptoms, laboratory investigations, and endoscopy also allows us to determine the severity of disease.